News Channel 8 presents New Skills for Living with your host, Tom Lavin, a healthy plan for healthy living.
Hello and welcome to New Skills for Living, a show dedicated to healing and wholeness in our community. We're really glad that you could join us today. We've got a really good show. In the last part of the show, we're going to be talking about codependency and caregiver burnout. We're also going to be talking about what are the challenges that one has to face when they have a chronic illness and how can we develop resiliency to deal with that. However, in our first two segments, I'm really glad we've got a really great special guest who's made a big difference in our community. Our guest is Diane Ross, who is the president and CEO of the Continuum here in Reno. Diane has been a part of the healthcare community for over 30 years, and she started the Continuum over 20 years ago. It was in 1993. She is active in numerous coalitions and committees that focus on quality home and community-based services, as well as advocating for changes in public policy that deal with health and human services. She is the recipient of the Human Services Network 2012 Humanitarian Award. So Diane, thank you so much for joining us today. It's great to have you with us here.
It's a pleasure to be here. Thank you for having me.
So how about if we just kind of open up with like an open question. Can you tell us about the Continuum and what kind of services you provide?
Well, I'd be delighted to do that. How much time do we have?
3 or 4 days.
Oh, okay. Well, we're a multi-generational program, and like you said, we're 20 years old, and we started off as a Medicare certified rehabilitation agency providing physical, occupational, and speech therapy services. But we knew that there was a strong intergenerational component to healing and wellness. So we have a child care center on campus that's a small family style that has a combination of typically developing children with special needs. And on the other side, we have an adult daycare program that usually 25 to 35 adults that come and spend the day with us. Twice a day, the children cross over into the adult day program, and we have an intergenerational experience.
Oh, how great is that?
Yeah, it's wonderful.
There must be some really good energy when the elders and the kids get together, huh?
It truly is, and I invite anybody who wants to come and take a look, because I believe that the multi-generational programs are really where we need to be. We're all in this together, and the only way that we're going to succeed and achieve quality of life, I believe, is that putting all these programs together.
Yeah. Now, can you describe to us adult daycare? What is that?
It's a program for adults who really should not be home alone. They need the stimulation, they need the socialization, and they need the health environment that allows them to be safe, but also to have some quality of life. And that's also for the caregiver as well. And I think, I'm glad you brought that up, because I think a lot of people think of an adult day program as a babysitting kind of a program, and it is not that way at all. It is full of fun and activities and celebration of life. And if it's okay, I'd like to read something to you that one of the wives wrote about her husband. She didn't want to bring him to the Continuum, but here's what she says. I hesitantly dropped John off the first day. It's difficult being a primary caregiver and giving up some of that responsibility. I felt like I was letting him down. When I came to pick him up later, I passed by the window and I could see a genuine smile on his face as he was visiting with another gentleman. We headed out to the car, and I could tell that he was more alert and engaged than ever. His voice had a new enthusiasm I had not heard in a while. Each day that I picked him up, he is rejuvenated and excited about the people he has been with and the activities that he has done. Not only has his quality of life improved, but so has mine.
Oh, that's beautiful.
Yeah,
that's really inspiring. And so rather than someone sitting at home just watching television, they're actually out with other people, and they're in a stimulating environment, and they've got a social network and friends. And can you tell us, can you describe someone who might, I guess maybe by diagnosis or by what's going on in their life, Diane, how they happen to be referred to your program? The day treatment program?
Well, oftentimes it may be a referral to our day treatment program, but it may be a referral to our physical, occupational, or speech therapy program. So a client may come in with let's say, a diagnosis of Parkinson's disease, and that person comes for a Big and Loud program, which is a specialty program for people with that kind of a problem. And we notice that the caregiver is looking pretty weary, and that maybe our client is in need of more than just the therapeutic intervention. And so we make that recommendation that they cross over into our adult day program. And Denise is our adult day coordinator, and she knows all. She's been doing this for a very long time. And she brings those people in, the caregiver as well as the care recipient, and gives them a tour and talks to them about what we do. If they're interested and they think this is the way to go, then we need a doctor's referral, and that's how we start the program off. And they can come anytime. Some come all day because their caregivers are working. Others come half a day, 2 or 3 days a week, because the spouse or the child or whoever's being the caregiver needs that time for themselves.
So it's flexible and it responds to the person's individual needs. That was a really nice introduction to hear from Diane, and right after this brief break we're going to hear more about the continuum. Hello and welcome back to New Skills for Living. You'll see up on your screen the website easeap.com. And if you go to that website, you'll be able to watch, or you can refer other people to watch Diane's interview from today. And then there are also 30 or 40 other interviews there with Steve Hayes, Jacqueline Pistorello, Alan Frazzetti, Victoria Follett, talking about acceptance and commitment therapy with depression and anxiety and substance abuse. So please go to the website to watch Diane and other really dynamic people in our community talking about important topics. And then I also want to remind you, those of you that have watched the show in the past, or if you're new, if you go to the website, there are over 100 newsletters that deal with gratitude, stress management, how to deal with anxiety, how to deal with children that are having problems, and these newsletters are there on the website for you. So let's turn back to Diane from the Continuum. And Diane, please tell us more about the programs that you have that are so important to individuals and families and to our community.
Well, like I had said before, we have a multi-generational program. About 3 years ago, we took on the Early Intervention Program, which is a statewide program that works with children 0 to 3 and their families. Most of that work is done in the home, although we do have some of the children that come to the Continuum. So we have a wide variety of special needs children. And I heard Pedro Martinez do a presentation a few months ago talking about the importance of literacy and how we could not wait till middle school before the children had identified their issues that they couldn't read. We needed to start early. And I thought, well, why not? Why couldn't we do that? Why couldn't we have fundraisers and develop a program? And we did. It's called Literacy Land of the Continuum.
Great.
And our goal by the end of 2014 is to have distributed 2,500 books and trained families in how to read or teach their children to read. It's a program that I think is really a great contribution to the community, and we have to start early. The same way that I talked about the importance of our children starting early in learning diversity and celebrating differences rather than being afraid of them. And maybe if we start young, that this is a program that will move on and it'll be better for us, for all of us.
And so you have instructors who teach parents how to teach their children to read?
We do. Our developmental specialists are all trained in that, and we have our speech pathologists are as well. So, so that's that one end of the program, and the little guys. And then in our older generation program, we just started a program that is a physical fitness program for seniors and people with disabilities. And that came from a lot of what we're seeing in healthcare is there is rationing. At times we're limited in a certain amount of visits that we can do. But we know that our adults, especially those with chronic health conditions, need to keep their bodies active. And so one of our great staff members who has like 15 years experience in rehab just got certified in senior healthcare training. And so we opened up a program. It's called the Back Room. And anybody can come, and usually it would be a physical therapist discharging an adult and moving them into a program where they can continue with their exercise and get one-on-one or small groups. So we're excited about that because we know that living with a chronic illness or healthcare issue is tough. But we know physical therapy and exercise is a great healer. So
yes, it sure is, isn't it?
We're excited about that.
Now, Diane, earlier you were mentioning that some of the people that get help at the Continuum have Parkinson's. And then during the break, you were mentioning other diagnoses or other problems that people face where they do come into the adult daycare program. Can you mention those to us?
Yes. I would say probably the majority of the people that come to see us have cognitive issues, of some form of dementia component, but we have people with strokes, people with Parkinson's, people with Alzheimer's. We actually have some adults with developmental disabilities. And so there's a wide variety of those kinds of diagnosis. And that's why I talked about the combination of the therapies and the adult day program.
Yes.
And also the people in the adult day program can cross over into the exercise program as well.
Yes.
And we do exercise every single day for a half hour, and everybody gets to do it. So we're all in that together. But bringing all those people together and sharing, you know, I think a lot of times we think of dementia as just the end of the life. And I will tell you that when I need a high, I can walk into the adult day program and sit down and have a wonderful conversation with many of those people. They have great stories to tell, and they love sharing them the same way they love the children when they come in, because there's no stigma.
Yes.
They love each other, and that's the beauty of it.
Yeah,
You know?
that is really beautiful. That's great news that's happening in our community, Diane, at the Continuum. We're going to go ahead and take a brief break, and we're going to ask Diane if she'll stay and talk with us a little bit longer about healthcare in our community. Well, and welcome back to New Skills for Living. We're talking with Diane Ross, the president and CEO of the Continuum in Reno, Nevada. So, Diane, you've been sharing with us the programs that you have at the Continuum, and can you tell us about the staff and also your community partners? I think that's quite exciting.
We have a wonderful staff. Our director of Carousel, which is our learning center for our children, has a wonderful background in behavior training and education, and is very dedicated to those little guys. And then in our adult day program, those staff are phenomenal. You have to go and watch what they do in order to really see their loving and their caring. And I think when I read that little piece that one of the parent or the wife wrote, you can tell that there's a genuine loving and caring, and a knowledge of when to or how to stimulate a person and to get them into conversation and that kind of thing. Our developmental specialists, we have 5 of those, and these are all ladies who are trained in the 0 to 3 population, and they are great. They have, not only do they work with the children, but they work with the parents as well, because we know that parents are really key in the growth of our little guys. Our speech pathologists, our physical therapists, our occupational therapists join the Continuum because they love diversity, and they love the idea that they can work with a little guy and then they can work with an older person. So we have therapists that are trained in for example, Parkinson's treatments. We have a speech pathologist who does the loud program, and a physical therapist who does the big program. We have occupational therapists who do work in many areas, from adults in driving skills, learning or assessing driving skills to fine motor coordination. We have physical therapists who are pediatric specialists, and we have geriatric specialists. That's so great. Huge variety. And then our community partners, we've had 2 grants from the Division for Aging Services, Division for Aging and Disability Services. One of them is a respite grant, so that we have some funds available for families who need some respite for themselves. And then we have a grant that we've had for over 12 years, and it's our Home and Safety grant. This grant allows us to go into the home of an older person, 60 years or older, who is at risk for premature institutionalization because of some kind of disability. We send in an occupational or physical therapist, and that person does an assessment of the person and their caregiver, and then we do a home evaluation. We come back, the therapist comes back to the Continuum, and our safety coordinator, home installer, goes into the home and modifies the home to meet the needs of both the recipient and the caregiver. We've had, it's a wonderful program, and we do a pre and post survey, so we're finding that we have reduced falls. Sometimes we stop the falls, and the person feels safer, and they stay in their home longer. So it's a win-win situation.
Yeah, families must really appreciate that kind of support.
They do. It's a wonderful program. We have a Mod Squad program too, which is private pay, but most of the time our people who are low income use that home safety program.
Could you talk a little bit more about respite care and how important that is for the identified patient and for the caregiver and the family?
Yes. I think a lot of times we know that it's 24 times 7 and that the caregiver needs to have some time away. And it may be that they may bring somebody into the home so that they can go out and just maybe have a day to themselves. Or they can come like to our adult day program where they can go home and maybe even take a bubble bath. And I remember one of the clients or recipient ladies telling me that's what she did. Her husband came and hung out with us, and she went home and took a bubble bath. And I thought, yeah, that's a good thing, you know, because that's relaxing. So I think that's so important.
So we have about a minute and a half, and I'd like to kind of, maybe we're kind of going back to the beginning here, but I was really enthralled just to hear your motivation for how you started the Continuum. I think that lets us know how important this is to you and your sense of mission. Can you tell us, like in a minute, the brief version of why you started the Continuum?
I think it's because I knew that we are all in this together. I had started off in an acute care hospital, and I realized that for so many of our people, especially with chronic disabilities, that was the beginning. It wasn't the end. When that person left the hospital, it was the beginning of a whole new way of life. And I knew that the only way we were going to be able to help the caregiver, the care recipient, and the whole family is it takes a village. And that village starts at day 0 until the end of life. And quality of life is giving and receiving at the same time. So I think that's inspiring. And if I could just real quickly read you something. We are the recipients of Generation United, which is a national organization, and a student wrote this letter. The Continuum has been able to take existing resources and a little originality to form a program that allows one of the most healing experiences of all, the human experience.
Yes.
And because of that, we received the Intergenerational Shared Site Excellence Award. But it's a human experience, isn't it? It's all of us together.
That's beautiful. Thanks for sharing that, Diane. So what Diane was saying, it kind of reminds us of Dr. Carl Menninger, who said that love heals. It heals those who give it and those who receive it. So we have one more segment in the show, and we'll see you right after this brief break. Hello, welcome back to New Skills for Living. In this segment, we're going to talk with Diane about chronic illness, and we're going to talk about the psychological stressors involved with a chronic illness, but then also the coping strategies and how the individual can bounce back from those. And I'm going to share with you, Diane, some statements that people with a chronic physical or mental illness will sometimes say. And then I'd like you to comment on them, okay? So let me go with the first few.
Okay.
So a lot of times someone with a chronic illness, again, it might be like diabetes, it might be cancer, it might be Parkinson's, it might be heart disease. They're saying, I'm not the person I used to be. Other people don't treat me the way that they used to. Everyone else is moving on with their life. I'm stuck. And people will sometimes say, I feel like this illness has overtaken my life. Can you share with us your response to that?
I can understand it. I think that so many of our clients that come to the Continuum have not just one, but maybe multiple chronic illnesses. And that knowing that they're not alone, I think helps. And with us, as they see the children and the adults all coming together, I think that there's a hope there that if that person can do it, then maybe I can too.
Yes, great, okay. So some of the other things, though, that we hear with people with chronic illnesses are, there's a feeling like I'm just a burden to other people, I'm no longer contributing. Why has life done this to me? Could you comment a little bit on those attitudes that you might see over at the Continuum with some patients sometimes?
I think we see that initially anyway when they come in. But a lot of times, again, I think it's a matter of giving these folks strategies and options. And we have choices. And I think they need to learn that. And I know in the chronic health programs, the options are really important. And don't we all want to have some control of our lives?
Right, we do.
And even though we have that kind of a chronic illness, it doesn't mean it's stopped.
Right.
We have options, we have choices.
And so let's transition, as you kind of are, into the solutions where some of the things that we hear from our patients is that I have an illness, but I'm bigger than my illness. I have my illness, but my illness doesn't have me. Kind of like what Dr. Viktor Frankl referred to as the defiant power of the human spirit. And I heard you kind of tapping into that. Could you tell us a little bit more about that kind of spirit of recovery that you've seen with your patients?
Well, you know, they're my heroes. And as I see them, I know that I'll give you an example is that with the Parkinson's disease, oftentimes the voice gets very small and it's hard to control the volume. And so in speech therapy that we will have the therapist will walk around with the client and that client has to boom out that voice, and you see the success going on. And if you make it fun, and there are a lot of, and we all have a great time together. So there's that humor that comes in there too, and I think humor is so important, and to be able to laugh. And I think that's one of the things I see as a healing. No, it's not going to go away, but yes, it can be better.
Yes, excellent. That's just beautiful. One of the things too is about liking ourselves just the way we are. I would imagine that's part of your program with your patients and families there, isn't it? Helping people just to love and accept themselves the way they are?
You bet, you bet. And to be honest, that's pretty much, I mean, I wish we could wave a magic wand and somebody with a stroke could walk out the door.
Yes.
But no, that doesn't always happen. And acceptance is sometimes a difficult thing. But oftentimes we make sure that the caregiver becomes part of our rehabilitation program.
Yes.
So it's a family unit, and again, it's everybody working together because it does take a village.
Yes, thank you, Diane. So a couple of other things too is about taking responsibility, knowing what our illness is, knowing about our medications, knowing those things that I guess are part of our treatment plan, those things that we take responsibility for to make our lives better and continue to live our lives. Can you speak a little bit about that theme that I'm sure you and your staff must address about taking personal responsibility?
Yes.
Okay.
In fact, that's the way it has to be. When we do an assessment, what we say is, what do you need? What do you want to get out of this?
Yes.
It's your program.
Yes.
And so you write the goals.
Yes.
And you take that responsibility. And it doesn't mean you just come 2 or 3 times a week. You go home and you do your thing, and that's how you're going to get better and achieve your goals.
Yes. So in about 30 seconds right now, Diane, for people that are watching our show, whether it's on TV, on Channel 8, or if it's on the web, and they've been watching this, and maybe they're struggling with an illness or a family member struggling with a chronic illness, again, like Parkinson's, Alzheimer's, FTD, having had a stroke, what's something that you would like to say to them in wrapping up in about 15 or 20 seconds?
I'd say there's always hope. I would say that you're not alone and that you can reach out because there are many things that are available to you. Sometimes you need the options.
That's beautiful, Diane. So up on the screen you can see the website where you can see Diane's interview. We want to thank you for joining us. Thanks to Diane Ross for coming and sharing her wisdom and experience with us. And take good care of yourselves, and thank you for joining us.